Welcome to Brightpoint. We're proud to introduce you to EPIC, a transformative program bringing mental health support directly to children and families where they live, learn, and grow. Early Prevention in the Community, or EPIC, is a voluntary program that provides individual and family counseling, community linkage, and advocacy for children and their families at school and in the community. EPIC is designed to meet families where they are. By offering therapy in homes, schools, and community spaces, we reduce barriers like transportation, scheduling conflicts, and stigma. Our goal is to make mental health care accessible, consistent, and effective. Therapy sessions can take place anywhere that's safe, private, and conducive to healing, whether that's a participant's home, a school office, a park or other community setting, or one of Brightpoint's offices. We believe healing starts when we meet children and families in the environments where they feel most comfortable. When children and families receive services through EPIC, they have the opportunity to engage in a number of evidence-based treatment modalities that have been validated as effective for addressing mental illness and healing from trauma. These treatment modalities may include trauma-focused cognitive behavioral therapy, which is a structured, short-term approach that helps children manage trauma-related thoughts and emotions. Eye movement desensitization and reprocessing, which helps children process traumatic memories using guided eye movements. Motivational interviewing, a collaborative method that encourages children to explore and resolve ambivalence about behavior change. And TheraPlay, a playful, attachment-based therapy that strengthens the child-caregiver bond. EPIC services are available year-round to families with children ages 4 through 18 who have a mental health diagnosis and reside in Winnebago County, Illinois. We offer services to children as young as 4 years old because we know that early intervention is key. The sooner a mental health concern is identified and addressed, the greater the chance for long-term success in emotional, social, and physical well-being. To learn more about EPIC, let's hear from Betsy Smith, the EPIC Program Manager.
EPIC is designed to support kids and families who are showing symptoms of anxiety, depression, ADHD, grief and loss, aggression, and poor social skills. We hope to be able to connect to participants and families as soon as possible to prevent behaviors and symptoms from becoming more problematic, hence the name Early Prevention in the Community. We hope to provide the support, education, and advocacy to help address behaviors happening in school or in the home. Because of the Winnebago County Community Mental Health Board half-cent sales tax, we are able to bring these services to families and kids struggling with mental illness. We are able to address the barriers of finding and getting mental health treatment by coming to them, whether in the school, meeting in the community, or getting them to the Brightpoint office. We hope to make mental health services more accessible and assure that kids and families receive the support they are seeking.
And now, let's hear a powerful example of how the EPIC program is creating real change in the lives of local children and families. John's therapeutic journey with Brightpoint's EPIC program is a testament to resilience. Referred for aggressive behaviors and emotional dysregulation, he had experienced significant instability, including 4 home placements in 6 months, before settling with his biological father, stepmother, and 6 siblings. Initially, John struggled with mood swings, aggression, and staying on task, both at home and school. His father and school staff were concerned and unsure how to support him. Through consistent therapy, John began learning coping strategies tailored to his developmental level. He gradually built insight into how his emotions, thoughts, and body were connected. With time and practice, John became more responsive to redirection, better able to focus, and increasingly independent in managing his emotions. His father, teacher, and school social worker all noted significant improvements. Even in a busy household, John applied his new skills, leading to fewer outbursts and stronger emotional control. John's progress reflects not only the impact of trauma-informed care, but also his own strength and capacity for growth. At Brightpoint, we believe data tells a powerful story. It helps us shape our programs and make informed decisions. We're excited to share highlights from our most recent fiscal year, July 1st, 2024 through June 30th, 2025. During this time, more than 80% of families reported a noticeable improvement in symptoms, and over 3/4 shared that they felt confident in the support they received from Epic Counseling Services. We're proud to have received over 100 referrals, and even prouder to have partnered with and served more than 50 families. These numbers reflect the trust our community places in Epic and the meaningful progress families are making every day. Let's hear another example of that meaningful progress directly from a parent whose child participated in Epic Counseling Services. This is a direct message from a parent of one of our Epic program participants. At Brightpoint, we are committed to offering services that are accessible to the children and families who need them. Epic offers flexible hours, including evenings and weekends, to meet family needs. We ask our participants to commit to weekly sessions because we know that monthly therapy models are often ineffective. And best of all, there's no cost to families. Our commitment is to providing accessible services to the children and families who need them, eliminating scheduling and financial barriers to treatment. Ready to learn more or refer a child? Contact Epic Program Manager and Brightpoint Leader, Betsy Smith, at esmith@brightpoint.org. Thank you for your partnership. Let's make a difference together.